Hi, and welcome to this video on managing short-term sleep problems. If you're watching this, then you probably experience sleep problems that have lasted less than 3 months. If that's the case, we recommend not watching the main self-help series on managing long-term sleep problems. The reason for this is that the techniques presented there are aimed at solving a harmful process that's been developed over time. With short-term sleep problems, that very process has not gotten time to develop, so you need a different set of advice, which will be given in this video. Here we'll focus on different causes of short-term sleep problems, how to avoid the harmful process which makes short-term sleep problems become long-term ones, and lastly we'll briefly cover the topic of sleep medication. Short-term sleep problems, also known as acute insomnia, is a common condition. We can say that about half of us will experience a period with sleep problems that lasts between 1 to 12 weeks, and just about everyone experiences a night of poor sleep once in a while. Here are some of the most common causes of short-term sleep problems. Demanding life events are on the top of the list as the most common cause. This includes changing your job, a divorce or relationship problems, changing residence, or the death of a loved one. Bodily diseases or stress. Environmental factors that affect sleep, such as noise, bright lights, or an overheated bedroom. Some medications can trigger sleep problems. If you're taking prescription medications and are experiencing sleep problems, then it's important to tell your doctor about it. A disruption of your normal sleep rhythm, also known as your circadian rhythm. This includes working a night shift or jet lag. Lastly, it's not uncommon for short-term sleep problems to arise without any good reason at all. The good news regarding short-term sleep problems is that in the majority of cases, it goes away spontaneously, without any intervention required. That's good news indeed. But still, we would like to give you some advice to help you in this process. Our main advice is to make sure that your short-term sleep problems doesn't become long-term ones. And the best way to do this is by following a daily routine where you get out of bed at about the same time every day and avoid daytime sleeping as best you can. This will help your circadian rhythm, and if you avoid daytime sleeping, then you're more likely to sleep throughout the night. It's best to try to rise from bed at the same time also during weekends. But if that's not an option for you, then you should strive to avoid a large gap between when you get out of bed in the weekend and during weekdays. Number 2, keep good sleep hygiene. We've made a separate video on how to set good conditions for sleep called sleep hygiene, and we recommend checking that out. Or you can use our checklists to see where you can make improvements. You'll find links in the video description. 3, if possible, manage the triggering cause. As previously mentioned, it's not always easy to find the triggering cause of sleep problems, but sometimes it's rather obvious. Examples include tailoring your workday and free time to include more relaxing and less stressful activities, avoid nighttime working, changing medication, and so on. If you're troubled by nighttime rumination, meaning repetitive and unproductive thoughts that keeps you up at night, you can benefit from constructive problem-solving strategies. We have a separate video on this linked in the video description. Number 4, don't fear sleep problems. Some people are terribly concerned by the potential harmful effects of sleep difficulties, making sleep a kind of life or death performance. If we're going to give a balanced presentation on sleep and health, we can say that yes, a good night's sleep is essential for a healthy body and mind, and not getting enough sleep can feel really awful. But both the body and the mind are made to handle periods of reduced sleep. In fact, years of research indicates that people who report having insomnia, meaning sleep problems, are at no more risk for diseases compared to normal sleepers. Unless your insomnia is itself caused by some medical condition like heart disease, cancer, sleep apnea, etc. So our recommendation is that you take sleep seriously by, among other things, following the recommendations we give in this video. But at the same time, keep a sober attitude regarding the potential dangers. The worst case situation here is that you fear lack of sleep to such a degree that you feel compelled to sleep when you can, for example at daytime or way past your normal bedtime routine. You'll then risk falling headfirst into an unfortunate spiral, which can exacerbate the problem, where short-term sleep problems can become long-term ones. Perhaps you've asked yourself whether sleep medication is an option. Summarized, we can say that there are drugs that help you fall asleep, called hypnotics, but unfortunately, hypnotics often give rise to potential unwanted side effects, which is why doctors only prescribe them in a very special set of circumstances. These side effects include drowsiness, reduced awareness in traffic, nausea, headaches, dizziness, and in rare cases, an increased risk of injury due to falling, psychosis, and memory loss. But the most important reason why doctors try to limit the use of hypnotics is that they don't really deal with the underlying problem. On the contrary, long-term hypnotic use can actually lead to worse sleep quality, and after a few weeks of normal use, your body develops a tolerance for the drug, where you'll need to increase your dose to get the same effect. It's also common to experience sleep problems when trying to quit hypnotics. The worst case scenario here is that you'll develop a hypnotics addiction, which can be difficult to recover from. If you still plan on using hypnotics, it's important to limit the use to a short period to avoid developing tolerance or addiction. If you've been using them for a long time, then this continuation should be gradual, while considering other sleep strategies, like the ones presented in our video series on dealing with long-term sleep problems. If you want to learn more about the use of sleep medication, we can recommend a good article from the American Academy of Sleep Medicine. See the link in the video description. That was what we had on dealing with short-term sleep problems. We hope you follow up on our advice in the future and that your sleep difficulties fade away, like they do with most people. If you eventually find that you've had problems sleeping 3 or more days per week for 3 months or more, we recommend our video series on handling long-term sleep problems. Good luck!